You're listening to Plug Into Health with Prevea Health, exploring healthcare topics that matter to you, the latest developments in health and medicine, and the inspiring stories that emerge from Prevea Health, our partners, and the communities we serve. June is Men's Health Month, a time to encourage the men in our lives to take care of their bodies by eating right, exercising, and working to prevent disease. Dr. Padraic Obma is an orthopedic and sports medicine surgeon at Prevea Health and sees firsthand every day how taking care of our bodies and not taking care of them can impact our health. Dr. Obma, welcome.
Thanks for having me, Angela. I appreciate it.
What are some of the most common conditions and injuries that you see in men?
Yep. The four most common conditions I see in men are going to be knee pain, such as meniscus tears or arthritis, hip pain, such as cartilage tears or arthritis, shoulder pain, which are usually related to rotator cuff tears or arthritis, and carpal tunnel.
Okay, and so why are these things happening to them? Is it a result of certain activities or...
Yeah, so in like high school, college athletes, it's usually more of a traumatic injury. But in people my age group, 40 and older, I'm 46, a lot of it's just wear and tear over the years, where I use the analogy of a pair of jeans. If people wear a pair of jeans a lot, they get a little scuff mark on the front of their knee. And as you keep on wearing those jeans, it turns into a little rip. Eventually, those jeans get ripped across the whole front of the knee because it's a wear and tear thing. And over the years, our bodies kind of do the same thing.
Yeah. So what can men do to ensure that they're staying healthy and avoiding those types of conditions and injuries?
So first of all, I think it's super important that people get plugged in with their primary care provider, right? Prevea Health has a lot of amazing primary care providers, but that's the base of all treatment. By the time people get to me, a lot of times prevention isn't the answer. We're looking at surgery. So the baseline is primary care for sure. And then working through our conservative care providers, such as physical therapists, is going to be really important. But generally, preventative measures is leading a good, healthy lifestyle. A BMI under 30 is important, right? So low weight, routine exercise, which could be low impact, such as walking or stationary biking. It could be running a marathon within reason, right? And just maintaining a good balance in terms of good sleep and habits are really important as well. And then listening to your body, right? A lot of times it's fine to work through a 1 or 2 out of 10 achiness if it's only been there a week or two. But if you get a 6 or 7 out of 10 stabbing pain, that's your body telling you something's not right. Or if that achiness has been there for 2 months, something's not right. So getting plugged in with primary care, or certainly people can meet with a physical therapist or come into the orthopedic office.
Mm-hmm. When you think of things like, men who do a lot of exercising or weightlifting or other things for physical activity, are there certain things that you can be mindful in that arena in avoiding injury?
We see a lot of knee pain in marathoners. Starting that marathon training program a little bit earlier might be important. Or certainly it depends on what the condition is and age group, but weightlifters doing a lot of overhead lifting can certainly put additional stress on the shoulders. I usually tell people, don't give up the activities you love if they're bothering you, but try to find a way to modify those. Example would be, I'm 46 now, so when I was 25, I might run a 6.5 minute mile. But now I'm happy running a 10-minute mile if I don't have any pain or aches, right? So I still feel like I'm 100%. I'm not 100% compared to when I was 25, but I've kind of self-calibrated and readjusted, and I feel great right now.
Yeah, so let's talk a little bit more about that. So as somebody who sees every day, right, various types of orthopedic injuries, conditions, you are on the front lines of health. What do you do to ensure that you stay healthy? Yeah. So what does an orthopedic surgeon and sports medicine surgeon do to be healthy?
I'm very much a creature of habit. So I know what time I have to be at a certain place. So I always get up 2.5 hours early. I have my routine of going for a run and do some resistance training. And then I eat a cup of berries, right? A cup of raspberries and blackberries. And then I go to work. I have my same stuff every day. I eat carrots and broccoli, and then I have a yogurt, and then I have a protein bar, and then I have like nuts and an apple. And then I get home and I eat like one of 5 different things. I'm probably too regimented in what I do, but it's a healthy, active lifestyle, right? I mean, 8 hours of sleep a night, trying to get a workout in most days, and trying to have some well-balanced diet with consistency. And then I also will say, again, I'm 46. Getting in for a yearly physical with my primary care provider, Dr. Jason Hoppe, is amazing as well, right? I think I can't stress that enough. A yearly, at least appointment with your primary care provider for a physical or just lab work or what have you is super important, because we're living longer and longer. Something is going to happen to each and every one of us at some point in time. So you need to be on the early signs of detection and prevention before it gets too late. So it's super important that people get plugged in with their primary care providers at Prevea Health to make sure that they're on the early side of things.
Dr. Obma, thank you so much. A lot of valuable information there for Men's Health Month in June. And to our listeners, be sure to check out another episode of Plug Into Health called Hey Man, Your Health Matters Too. That's featuring Prevea family medicine doctor, Dr. Connor Roberts. He discusses the importance of annual checkups and some of the key health conditions that primary care physicians are on the lookout for in men. You've been listening to Plug Into Health with Prevea Health. To learn more and to submit ideas for future shows, please visit prevea.com/podcast. And please remember, the information provided in this podcast does not constitute medical advice. It is not intended to replace interactions with your healthcare professional. And if you are concerned about your healthcare, you should consult with your healthcare professional. You can learn more about Prevea Health at prevea.com. Thank you for choosing to plug into health with Prevea Health.